Atrial fibrillation is one of the most common irregular heartbeats that you can have. You quite often are not aware that you've got atrial fibrillation. It just feels maybe like an odd occasional extra beat, or some people are so used to it that they just don't notice they've got an irregular heartbeat. The problem with the irregular heartbeat is that blood then has the chance to form a clot, and that clot can be squirted out of your heart to parts of your body. If it happens to your brain, that's a stroke, and it can be potentially serious. The figures suggest that 1.5% of over 60-year-olds will have atrial fibrillation, and that the risk of anybody developing atrial fibrillation at some point in their life is 1 in 4. That atrial fibrillation could be temporary, just a quick in and out, but it could also be a permanent change, and it could need investigation and management. One of the big consequences of having a stroke, obviously, the things that we can see, the changes to your face, to your arm movement, to your speech, those things that we tell people fast, face, arm, speech, telephone for an ambulance, those things are the major consequences of a stroke. There are smaller consequences where small clots are formed, tiny little clot showers which travel to the brain and cause tiny little areas of damage, which we now know is a form of dementia. It causes a thing called vascular dementia. Atrial fibrillation can stop, can restart, can be difficult to catch at the time. Using devices like the Kardia device, we can get rid of the element of luck. If you're feeling palpitations at this moment in time, let's check your pulse at this moment in time. Let's get an ECG right now. No sending you off to get it organised at the hospital. We use the Kardia device, which is a small portable, almost a piece of plastic with 2 bits of metal on it, that connects to a mobile phone and allows us to do a single lead ECG, and that can tell us within 30 seconds whether we're dealing with somebody with atrial fibrillation or not. We also do things like flu clinics, make them screening points, because the instance of atrial fibrillation increases with age. So that group of over 65s coming for flu jabs are really our target group. And the treatment is very straightforward. We can get them seen by the cardiologist and started on medication that thins the blood and stops the clots from forming and prevents them from having any damage.